Welcome. In this explainer, we're going to break down a really common but often misunderstood condition. We'll be using expert information from Arka Anugrah Hospital to guide us.
You know, a lot of people experience discomfort, and they're just not sure what it is or what to do about it. So today, we're going to get some clear, expert answers. Okay, let's dive right in.
All right, first up, let's get to the basics. We hear the term piles all the time, but what does it actually mean from a medical standpoint?
So what exactly are we dealing with here? Well, piles, or hemorrhoids as they're officially called, are basically just swollen and inflamed blood vessels right there in the lower rectum and anus. And there's a key difference to know. They can be internal, meaning inside the rectum, or they can be external, which is just under the skin.
Here is a fantastic way to think about it. It helps to picture them as being a lot like varicose veins. I mean, it's the same basic idea, swollen, bulging blood vessels. They're just in a different spot.
So what brings them on? As you can see, the triggers are often things from our everyday lives. It could be anything from straining on the toilet, dealing with chronic constipation from a low-fiber diet, or even major life events like pregnancy. And yep, even just the natural process of aging can be a factor. Okay, so now we know what they are and what might cause them, but the big question is, how do you know if you have them? Let's talk about what you should be looking for.
One of the absolute most common signs that people notice first is bleeding. According to the experts, the blood is usually bright red, and that's actually an important clue because it tells you it's coming from the lower part of your digestive system. Now this is really interesting, the difference in pain. See, internal piles usually don't hurt, and that's because there just aren't many pain-sensing nerves deep inside the rectum. It's the external piles, the ones that form under the skin where there are lots of nerves, that typically cause that really noticeable pain and discomfort.
And it's not always about bleeding or pain. You might also have to deal with itching and irritation, or you might actually feel lumps. They can be anywhere from the size of a pea to a grape. Another common thing is that frustrating feeling like you just can't completely empty your bowels.
Now I get it. It can be really tempting to just ignore these symptoms and, hope for the best. But the experts are very clear on this. Waiting is just not a good strategy. Let's break down why.
Let's be honest. A big hurdle for a lot of people is just feeling embarrassed. But this quote really puts it all into perspective. For a doctor, this is just another part of their day. Seriously, there is nothing to be embarrassed about. And getting past that feeling so you can get help early on can make treatment so much easier.
And this is why acting early is so important. If you don't treat them, piles can actually get worse over time. They can move through 4 different grades, and as you can see, each one gets a bit more severe. So when is it time to pick up the phone? The bottom line is you should see a doctor if you have any of these signs, especially any kind of bleeding. You always want to get that checked out to make sure it's not something else. And of course, if home remedies aren't cutting it or the pain is really bad, it's definitely time to get a professional opinion.
So, what happens after you get a diagnosis? Well, the really good news is that there's a clear path forward with a whole range of modern treatments that can bring relief. Treatment really gets tailored to how severe the situation is. It can start with simple, conservative steps like changing your diet. For cases that are a bit more stubborn, there are minimally invasive procedures like rubber band ligation or sclerotherapy. And then for the most severe cases, surgery can offer a permanent solution.
And, medicine has come such a long way. There are now advanced techniques like laser treatment, which can mean a whole lot less pain and a much quicker recovery time for patients.
Of course, all the treatments in the world don't mean much without the right medical team. Since all our information is from Arka Anugrah Hospital, let's just take a quick look at the kind of expertise they offer. We are talking about some serious experience here. The team is led by pioneers like Dr. Ramesh Makam. I mean, look at that, over 45 years of specialized experience. That's just incredible. And he's joined by Dr. Saraswati Ramesh, another giant in her field with more than 4 decades of her own experience, known for her really compassionate approach to surgical care.
And it's not just about 1 or 2 amazing doctors. The whole approach is about comprehensive care. They bring together a whole team of specialists, as you can see here, to make sure every single aspect of a patient's health is looked after.
Ultimately, what it all comes down to for any good medical team is a mission just like this one, combining the best of modern medicine with real human compassion and precision. So there you have it. Understanding the symptoms and knowing your treatment options, that's the critical first step. The next one is taking action. We really hope this breakdown has given you the clarity and confidence you need to take charge of your health. Thanks so much for tuning in.